Hi, Doc.
Hello.
Uh, hello everyone. Welcome back to another Facebook Live session with me, Audrey. So, just recently, Gretchen Ho had her LASIK with us. So, this afternoon, we decided that why don't we discuss the process that she had to go through before, during, and after her LASIK surgery. We'll also be talking about the different options you have in case you don't qualify for LASIK. But before we do all that, and before we introduce our featured doctor today, let's say hello to the employees of Sky Cable who are watching us from the comforts of their home, or maybe for some of them who have already gone back to the office. And joining us this afternoon is Asian Eyes LASIK and Refractive Service Director, Dr. Robert Ang. Good afternoon, Doc.
Good afternoon, everybody. Thank you for
So,
joining us.
So Dr. Robert Ang, aside from being a LASIK doctor, he also specializes in glaucoma, cataract, and comprehensive ophthalmology. He underwent integrated arts and medicine program for his pre-medical degree at the University of the Philippines, and he did his rotating internship, medical degree, residency in ophthalmology at UP-PGH. And later on, he pursued fellowship training in glaucoma and cornea and refractive surgery at the Harvard Medical School in Massachusetts in the United States. So aside from authoring several book chapters and international publications, he's also a key resource speaker in local and international conferences. He's an active researcher with interest in refractive options. So that's important for a lot of viewers today, because if you're looking for an expert who knows what he's talking about when it comes to yung options mo, when you want to get rid of your glasses or contact lenses, then Dr. Ang is the right person to talk to, whether it's about LASIK, ICL, suprachor, or corneal inlays, as well as other eye problems like cataract and glaucoma. And one of the interesting things about Dr. Ang is that he's also the clinical investigator of pioneering treatments such as suprachor, as well as mixed with eye stent, camera corneal inlay, to name a few. He's also a multi-awarded doctor and has received several Best Paper awards from the American Society of Cataract and Refractive Surgery, the Asia Pacific Academy of Ophthalmology, as well as the Asia Pacific Association of Cataract and Refractive Surgeons. Okay. Among some of his awards are to be recognized as a Certified Educator Award from the APACRS, the Top Gun Instructors Award from the ASCRS, as well as to be recognized by the International Society for Refractive Surgery through its Presidential Recognition Award by the American Academy of Ophthalmology. He's also been voted as one of the Powerless 100 by the Ophthalmologist magazine. When it comes to training the next generation of doctors, Dr. Ang is also the head of the Refractive Surgery Fellowship Program. So that means he's the one that's been training the younger doctors on how to be LASIK surgeons. And and I think one particularly important item in his credentials is that he is the Philippines' most experienced and most awarded refractive surgeon. He has been doing LASIK surgeries for 20 years, that's since 2001, and has probably performed more LASIK PRK and ICL procedures than anyone else in the country. So, Doc, we all know that we've heard it, right? That you have a lot of experience when it comes to LASIK and the different options when it comes to getting rid of your eyeglasses or contact lenses. So, what is LASIK, and ano ba yung eye conditions that it really corrects?
So, to the audience naman, LASIK means actually the whole refractive surgery means that we adjust your grade, no? We adjust the power of your eye so that you depend less on glasses, no? Or contact lenses. So, more people want their options, and we try to give them as many options as possible. So here in Asian Eye, we do everything that is offered in other centers in the world, we offer it here. So the most popular remains LASIK. So LASIK surgery means that we make a flap and then we laser the grain. No? So more than like 100 million people in the world have had LASIK. So a vast experience, many happy patients. Of course, you read some problems with LASIK before, especially in the early years of LASIK. But now, it's something that everybody does, no? Kaya many people are coming for LASIK. So LASIK is the primary choice of most patients. And if you have friends or relatives who've had laser surgery, it's probably LASIK.
Okay. And then, Doc, when it comes to yung pinag-uusapan kasi natin na refractive errors, di ba? Ano ba yung sinasabi ng difference between kapag sinabi sa akin na nearsighted ako versus kapag sinabing farsighted? Or kapag sinabi nilang, I have astigmatism also?
So, yung grade kasi ng mata, so yung eyeball natin, bilog siya, parang ping pong ball yun, no? If the eyeball is round, there's no grade. People don't wear glasses, malinaw yung far. Pero kung mahaba yung eyeball ng isang tao, then they are nearsighted. Nearsighted means you see near without glasses, but for distance, you need glasses.
Okay.
The other side of it is a shorter eyeball. So if your eyeball is shorter, then you are farsighted, meaning you see far, maybe not so sharp, but sa reading, mas mahirap ng konti. So these are the differences. And then, astigmatism naman, everybody hears about the word astigmatism, no? It means that the front part of your eye, the cornea, is a little bit oval. So astigmatism is also one of the grade, no? Isang klaseng grado, which you need eyeglasses, contact lenses, or laser surgery. So these three, whether you're nearsighted or farsighted, it can be combined with astigmatism.
Okay.
Then
Okay.
there's another one. If you are 40 years old and above, your near vision weakens because of age. So it's an age-related weakness in focusing for near. So you need reading glasses. If you are nearsighted, meaning near is you have nearsighted but you have presbyopia, then probably you're wearing progressive glasses. So, yun naman yung progressive glasses, yung sa taas for far and then sa bottom part of your grade is for
For
near.
reading.
So, iba-iba yung klaseng grado. So, usually your doctor will measure, sa optical shop, pinimeasure yung grade, no? Pinimeasure yung presbyopia. But it's glasses, so if you want a solution, you come to us.
Okay. So basically that answered the question kung bakit mo ba pipiliin mag-LASIK. So the first, of course, is that ayaw mo na ng hassle at saka discomfort of wearing eyeglasses or contact lenses. And then for you, Doc, what are the other benefits that you've seen na na-enjoy ng mga patients who undergo LASIK?
So, most people want to enjoy life na hindi sila dependent on glasses. It doesn't mean they don't want to wear glasses because now glasses are fashionable. Eh.
Yes.
I have patients who want to see clearly, pero they want glasses just to look nicer. Pero the glasses are great. So the frame is part of the look of the patient. Pero they want to be able to enjoy sports. So the first thing is to enjoy sports, diving, swimming, target shooting, biking, motorcycle, mini motorcycle, or bicycle riders now, you wear helmets, you want to wear a nice pair of sunglasses, then gusto mo malinaw.
Polarized. Yes,
so, yung functionality of waking up and seeing everything, and then the glasses are for decor of your face, no? So, the second thing is, syempre for work, no? Some people who pilots come to us. Some people who, before they go to pilot school, they come to us. The flight attendants, they come to us because they want, the job requires them not to wear glasses for emergencies, no? The other thing is people who have worn contact lenses for 10 years, then namumula na, mahapde, no? Masakit. So medical indication yun kasi nagko-contact lens intolerance na or allergy. So itong mga taong to, they come, no? So aside from not wanting the glasses, seeing clearly with or without glasses is like the goal of the patients. And now COVID, many people wear masks, and your mask, you exhale the air here and then it smokes your glasses. I don't know if you know.
Yes, may fogging.
It smokes your face shield, no?
Yes,
So ang dami naming patients now who are coming for LASIK because of that inconvenience. Now people have time to come. So many people are having LASIK now because you don't have to go 9 to 5 every day, Monday to Friday to go to work. So all those are good enough reasons to have corrective surgery. No, it's not just LASIK, but corrective surgery. So we offer that for everybody.
Yes. And I think, Doc, another thing, lalo na if you're a person that has worn glasses for a long time, you started very young, chances are kasi when you get mga 21 or 22, ang kapal na ng glasses mo. So even if you wanted to have the fashionable glasses to wear, makapal pa yung lens. So medyo mabigat na rin siya at a certain point. So you
Yes,
become like a good candidate to do LASIK.
yes. So I see some questions in the Facebook, ano. I'll try to
Ah,
answer the questions kasi I think during the discussion lalabas lahat ito eh. So first is what grade we can do
mhm.
for LASIK, no? So
Yes.
we start LASIK from 100 to 1 to usually I do LASIK from 100 to 600 grade.
Okay.
Astigmatism up to 400 to 500 grade. But for above 600 grade, I suggest ICL or implantable contact lens because the higher the grade, the more tissue we have to remove in the cornea, and it's not necessarily safe to remove too much tissue in the cornea.
Oo.
So the other option, which I hope many people read about and can hear about, is ICL or implantable contact lens. That is over the past 10 years now considered the top of the line of corrective surgery. So if you want as perfect a vision as possible,
You go with
actually
ICL.
ICL is number one and LASIK is number two.
Okay.
Whichever grade, no, from
Oo.
100 to 1, the ICL can treat 100 to 1,800.
Okay, okay. It's a much
Can
wider
treat
range.
100 to 600.
Okay.
But the ICL can treat much more than that. No?
Mhm.
So, uh, yung grade-wise, malaki yung range. But again, syempre patients come and we explain, no? Kung
Mhm.
pasado sa LASIK at pasado sa ICL, sila na mag-choose. If bagsak sa LASIK, ICL lang, di ICL lang.
Mhm.
Actually, pwedeng bagsak sa both. Pwedeng
I
bagsak sa
see.
LASIK,
Oo.
bagsak sa ICL. So, why is that? Number one, age. If you're below 18, we prefer not to touch the eye, no, because we consider in Asia we consider 18 years old as adult age. So
Okay.
usually my LASIK and ICL patients are between 18 to 60 years old. Beyond 60, patients usually have cataracts and
Mm-mm.
we have cataract surgery for them. So age LASIK 18 to 60, 100 to 1,600 LASIK, 100 to 1,800 ICL.
Okay.
No? Aside from other criteria, syempre may mga testing kami dito. So we have the most thorough screening procedure. If you've been here to patient eye, you will know that we have machines that double check other machines
Mhm.
because safety is the paramount here. No, we should be we are sure that it's safe for you to proceed. No, if it's not
Mhm.
safe, alanganin. Ako yung magsasabi sa inyo na do not do it. No, do not
Oo.
do it because we don't want you to have a problem. And I tell patients, if you have a problem, it is my problem to fix your problem. So I
Oo.
don't want you to have a problem. So
Yes.
if it's safe, we proceed.
Mm-mm.
So age and then um, the type of treatment in LASIK. If you are young, if you are
Mhm.
below 40, we do wavefront guided LASIK or the top of the line LASIK is called wavefront guided, and our machine is a Bausch and Lomb machine, which is a German machine, and we call that Zyoptics.
Okay.
If you are above 40 years old, meaning combination of far and reading, then we have another software, not Zyoptics, but it's called SupraCore. It's also LASIK, but it's called SupraCore. So the Bausch and Lomb machine can do Zyoptics LASIK for 80 to 40 and SupraCore from 40 to 60. So
Okay.
yun yung mga category na ginagawa namin, no?
Oo.
So,
So that's how
papagayan
it
yung age, yes.
yes. So it depends talaga, Doc, on the unique condition of the eyes. The reason you're so thorough is
Yes.
because iba-iba talaga yung condition ng mata ng tao. And
Iba-iba
just
eh.
because,
Hirap magsabi, no? So, pagdating ng
yes.
patient, kailangan thorough screening. So, pag-screen namin. Yun, meron pang isang option. So, there are actually three types of refractive surgery. ICL, which is non-laser,
Mhm.
LASIK, which is laser, and there's another one called PRK or photorefractive keratectomy. So the PRK is also laser. Now, the difference between LASIK and PRK is this. In 1988, when the laser to correct grade was invented, the laser was applied on the surface of the eye. So,
Mm-mm.
laser yung surface, tapos-tapos na. Ang tawag
Okay.
yan PRK. So, PRK was the beginning. Pero PRK, because you laser the surface, yung surface wound masakit,
Mm-mm.
makapit. So,
Mm-mm.
3 days of intense pain and torture and blurry and longer visual healing.
Oo. Oo.
So, the companies, innovators invented a blade to cut a flap. So, in 1994, 1995, na-invent yung pang-cut ng flap. So, nung nag-cut ng flap at binuksan yung flap, at ni-laser sa ilalim ng flap at binalik yung flap, yan yung LASIK. So, nanganak yung LASIK maybe 8 to 10 years after PRK. So, LASIK heals faster and no pain. So, guess what? Everybody wants no pain. So, LASIK na from there, LASIK exploded and everybody wanted LASIK. Pero, not everybody is qualified for LASIK kasi kung manipis cornea mo, hindi
Hindi ka
pwede
pwede.
mag-flap.
Yes. Wala
Kaya
kang
kung
ikakat.
manipis, don't cut a flap, PRK ka. So kung manipis cornea mo, hindi ka pwede LASIK, pwede ka PRK or pwede ka ICL
Okay. Okay.
kasi hindi pwede.
Yes.
Now, in year 2001, 2002, another laser was invented to cut the flap. So, femtosecond lasers cut the flap. So, noong 1995, blade cuts the flap. Noong 2002, a laser cuts the flap. So, ang tawag doon, bladeless LASIK. So,
Okay.
ngayon, bladeless LASIK na. Ang message ay lahat ng patient bladeless LASIK. Bakit bladeless? Kasi yung blade, while it's reliable, there is like a 2 to 3% chance that once it cuts, it causes an accidental complication na mali yung cut.
Okay.
So, the bladeless LASIK can cause a complication. Whereas the laser to cut the flap does not cause a complication, almost zero complication. So, syempre, safety the paramount. Okay. Importante, lahat ng tao walang problem after surgery. So, ayaw namin problem. So, here it is like everybody gets bladeless LASIK. No? So, ganun yung iba-iba. So, first, screen yung gaano kataas yung blade, gaano kataas yung LASIK. So, minsan, sobrang taas ng LASIK mo, sobrang taas ng blade, hindi pwede. Manipis cornea, hindi pwede. May mga hindi pwede. So, ganun kami.
And Doc, based on what you're saying, is that every time nagbabago ng generation, ng LASIK machine or LASIK technology, one of the major factors that they consider is how much safer will it make the actual procedure.
Yes.
And then, in our case, so the machines that we're using, Doc, you were saying already na, syempre, mas mabilis siyang gawin. Kasi instead of if a doctor having to use a blade to make the incision, it's already a laser that does it.
Yes.
So that laser, Doc, must be very fast to be able to do it and to do it painlessly. Why is it important then nga to make it that quick and that precise?
So, kasi yung actually nowadays, the trend in medicine, not only eye, the whole body, is to make the procedures as safe as possible. So as little chance of complication. So the chance of complication in LASIK now is almost zero if you use a laser to cut the flap. Second is comfort. The patient should not feel any pain. So since there's no blade and we have anesthesia, the patient has no pain. Next demand of the patient is, I want to see well the next day. Di ba? Lahat ng pasyente gusto, next day
Oo.
2020 na ako, gusto ko next day
Oo,
2020
oo.
na ako. Di ba?
Makakabasa na ba ako?
So,
Yes.
kasi gusto ko na bumalik sa trabaho. Although now, pandemic, walang ganun, no? Pero, so, next day, pag bladeless flap, mabilis mag-recover. ICL, mabilis mag-recover next day. Yung matagal mag-recover is PRK. So,
Mm-mm.
we only do PRK if the patient does not qualify or some patients choose PRK kasi yung walang flap, pag na pag nagsusport sila, yung mga nagta-taekwondo, judo, yung mga
May
military na
contact.
pwedeng
Yes.
tamaan, hindi pwedeng may LASIK flap.
Flap.
So, PRK sila. So, hindi yung PRK is not a lower procedure. It's just that there is a choice. If you don't qualify here, we put you here. Diba? So depende yan sa situation. So,
Oo.
binabagay namin. Kaya, when you're here and you come to us, we kind of interview you. Oh, what do you do? What's your job? Do you drive? Di ba? Parang computer ka ba all day? Mga ganyan. So,
Oo.
part of the total care of the patient is to know what you need, no? Para ibigay namin, importante masaya yung patient eh. So, we have to give what you want, no?
Mm. And Doc, when it comes, kasi when the way that you're explaining it, dun ko parang nakikita na yung sinasabi nila, it's customized LASIK. Hindi siya the same kind of LASIK for everyone. It really has to be customized to your condition, to your specific needs, and to your goal. So yun, goal ko, gusto ko makapag-sports. And yung sports ko, contact sports. So mas maganda nga talaga ang PRK for you versus a person that's just an office worker or student. There's no concern about anything that hits the eye. Then a bladeless LASIK option is good for you naman.
Yes.
And then, Doc,
Yeah.
another thing that I hear often for patients that are thinking of getting LASIK is, paano kung gumalaw ako? Nakakatakot na magpa-LASIK surgery. If let's say, nakahiga ako, tapos bigla akong gumalaw, baka ma-laser ang wrong part of the eye.
Yung laser kasi namin, and most lasers, yung laser namin kasi, may tinatawag na eye tracker. So pag nakahiga ka, when you're lying down, when we activate the laser, it locks into your eye. May camera, high-speed camera doon. So kahit gumalaw mata mo, may parang radar and pina-follow niya yung mata. So hindi magkakamali yung laser. And if you move too much, the laser will automatically stop. And then, pag bumalik na yung mata mo, nakatingin ka straight, then titira ulit siya. So, during the procedure kasi, no, I talk to the patient, narinig yung boses ko, oh, look straight, look at the red light, para hindi kayo kabahan. Alam mo, lahat ng tao kinakabahan. We understand that. Pero, it used to be that we give them a sedative, pero ang masama doon, pag nakatulog sila, lalong hindi sila tumitingin doon sa tamang lugar. So, we stop doing that kasi nga, some people cannot control it and they fall asleep. But we give enough anesthesia, they don't feel any pain. So, the movements are not a problem. We have an instrument to keep the eyes open, so hindi makaklose yung mata nyo. So, the only discomfort usually during surgery is nasisilaw kayo kasi may ilaw yung laser. So, nakakasilaw, no? So, yun yung mga type na pag nandito na kayo, we try to make you as comfortable as possible, no?
Okay. And then, Doc, how about yung idea of, like, some people have asked me, pwede bang yung LASIK na meant for me, baka mabigay sa ibang pasyente or vice versa? Is there ever a chance of that happening?
Our laser, the Bausch and Lomb laser, has a tawag dito iris registration, no? So, kung nanonood kayo parating sine at nakikita yung sine na papatong niya yung mata niya, tapos may titingnan sila, ma-identify kung sino sila, yung laser namin may ganun. So, we take a photo of each of your eyes during screening. So, sa screening test, may photo na kayo. And the screening machines are connected by local network to the laser. So 8th floor to, nakakonnect sa 10th floor. So the laser will get the data of your eye. So when you lie down there and I switch on and activate your treatment, it will first take a photo and match the laser photo to the test photo here from the 8th floor. So may identification. Hindi magkakamali yun. Kung nilagay ko yung left eye mo, tapos right eye yung treatment, hindi rin siya tutuloy. Sasabihin niya, not recognized. Ganyan. So, hindi pwede. Kaya hindi magkakamali yung right and left eye mo sa laser namin. Pati tao, no? So, hindi siya nagkakamali. Kaya, very confident kami about our machine here.
Okay. And then, Doc, I'm sure that you're seeing the chat function din para ang dami rin nagtatanong ng mga questions. So, but one of the main ones I always hear is, ano bang grado ang allowed for LASIK? And you've already said that from 1 to 600, you
Yes.
can do LASIK. And then for 1 to 1,000, pwede siyang ICL. And then, so Doc, that means na kapag gusto ko magpa-LASIK or any laser procedure, ang minimum mo naman is the 100. Nothing that goes lower than that.
Well, may tao 50 yung magpapilot. Gusto nila.
Oo. As close to perfect as possible.
50 pwede. So, nakakuha naman ng machine namin kung ano yung grade ko talaga. Pero, syempre yung mga 50 grade, kung mababa lang, ako rin, I try to discourage patient. Kung 50 lang, kaya mo, babat ka naman gagastos, di ba? So,
yes.
we also test the patient before that, no?
Mm-hmm.
So, that's one thing that all of these discussions will happen during counseling. So, we screen you, testing. After that, I talk to you. So, I spend time to answer the questions. Ganun, kasi may mga patient, may mga specific questions about themselves and their eye. So, sasagutin.
Okay. And then, Doc, ano yung other considerations? Because you said that we have one of the most extensive, most comprehensive Lasik screening procedures. So, of course, we have to find out kung anong age sila, between 18 to 39 or 39 to until 60, right? And then, you already mentioned yung corneal thickness. Aside from that, what else are you looking at?
First, contact lens wearers should rest their soft contact lens 5 to 7 days before having the screening. If you are wearing RGP, rigid gas permeable, or what we call hard contact lens, 3 weeks bago kayo pumunta sa amin. Pahinga yung mata, just wear glasses. Accuracy is very important. Next is, so, yun lang ang preparation. Yung mga naka-glasses, they can come anytime for screening. Pero yung mga naka-contact lens, dapat may rest time kayo before coming here. Soft contact lens, at least 5 days before. Stop contact lens wear. Hard contact lens, 3 weeks. Yun lang ang preparation. No other preparation. Kahit puyat kayo the night before, lasing kayo the night before, doesn't matter. Okay? Then, during surgery, hindi pwedeng may perfume, may makeup on surgery day. Kasi the vapors, the smell, and the powder cannot be allowed inside the laser room. So yun lang yung mga preparation nyo. Tapos, kami na yung bahala sa iba, mag-i-explain.
Okay. How about, Doc, the people that already are experiencing yung mga dry eyes na situation, lalo sa mga tao nag-work from home or matagal na even prior to pandemic, it was already a problem.
Dry eye is becoming more and more common now because of number one, air condition use. So must aircon, must dry. Electric fan must dry. Computer use, long hours of computer use or reading must dry. So most people now we advise to put lubricants. Now, one of the most notorious causes of dry eye is long-term contact lens use. So yung mga naka-contact lens na matagal, maganda na meron kayong lubricant. Kahit anong klaseng lubricant, basta basa parati yung contact lens nyo, you'll be better off than natutuyo yung contact lens nyo. So, we treat your dry eye first or we treat your dry eye after. But all patients will experience some temporary dry eye for at least 6 months after surgery. So, you have to be on lubricants. And we tell patients about this, no, para maintindihan nila. And then you put drops. Pag nag-drops kayo, you'll be fine.
Okay. And then, Doc, how about those people na baka they have retinal problems or diabetic patients?
Yeah, so we check inside. There are several things that are notable to check. Number one is cataract. So cataract, the lens clouding up. So pag may cataract ka, rare below 60, pero minsan meron. So about 60, that's why 60 is an important. So in the eye, 40 and 60-year-old are important milestone ages. 40 years old and above, middle class. 60 years old and above, cataract. So pag may cataract, disqualified. Cataract surgery ka. Pag may retina problem, the back of the eye, we have retina specialists here. Make sure na walang manipis o walang butas. Kung hindi, kailangan i-retina laser yun before the LASIK, before the ICL. That's part of the screening test. Glaucoma, which is a hereditary disease. If your parents or grandparents have glaucoma, you tell us. Kasi during your screening, we can test for that also. Kung may glaucoma ka, disqualify. Kung may cataract ka, disqualify. Pero kung may retina thinning ka, hindi ka disqualified. We just have to make sure the retina is okay with the retina doctor. So, yun yung mga kasama yun sa screening namin.
Okay. And then how about, Doc, those who might be pregnant or those who are still nursing? Pwede ba sila magpa-LASIK?
Pregnant, no, until about 2 months after giving birth. Then we can screen you.
Mhm.
Those who are nursing, pwede basta 2 months after giving birth. One thing about hormones is hormonal changes in women cause fluctuations in grade. So even if you've had LASIK, sometimes you notice that during pregnancy parang lumabo, and then nung nanganak ka na, bumalik na yung linaw. Another thing that hormones cause is dryness. So pregnancy and menopause cause dryness. So yung mga yung importante.
Okay. And then, Doc, earlier kasi that you were already talking about kung paano ginagawa yung different kinds of vision correction procedures. And you also mentioned a little bit about na between PRK and LASIK, mas mabilis ang recovery mo sa LASIK kasi you do parang less done on the eye itself. So when we say ako nagpa-PRK ako today, it'll take me about 3 weeks until I am able to have a little mas na malinaw na talaga yung vision ko.
Yung PRK, not naman 3 weeks. Siguro 1 week, you're okay. Yung PRK kasi, pinipili namin kung sino yung PRK, no? Kasi, if you're qualified for LASIK, PRK, or ICL, pwede qualified ka for all, eh. Then those patients choose LASIK. Some patients choose ICL because they have read and they know that ICL gives the best quality of vision.
Okay.
So, but yung mga nag-PRK, it's not bad, but usually a week of a little bit of less
Discomfort.
activities. Then after a week, they're okay. After 1 month, they're more okay.
Okay. When it comes to downtime, Doc, so let's say I get LASIK done today, what can I do within the first week and what can I do within the first month?
No, they can go back to computer work. Most people work at home, eh. So by 4th day, they're working.
Okay.
Just like driving, yung mga masyadong malayo, medyo mahirap pa. Pero a week or 2, it's better.
Okay. So ang kailangan lang talaga with that, Doc, is just to determine what kind of surgery is recommended for you. Kailangan mo magpa-screen, yung mahalagang first step na magagawa.
May mga question about profession, ano? Nakikita ko, contact sports, profession, ganito, no? So,
Yes, Doc.
Oo, mga ganyan. Kasi yung for the normal everyday person working in the office, the safest treatment is the best for you. So if it's safe to proceed with LASIK, we will do LASIK. If it's safe to proceed with ICL, we will do ICL. If some here are doctors or surgeons, ganyan, and your working distance is this, whether LASIK or PRK is okay.
Okay.
Now, if you're above 40, iba ng usapan kasi you need reading glasses or you want to do supra or LASIK, no? So, yun yung mga consideration. We measure actually yung measure na working distance, no? Tapos meron pang tanong dito about touch up. Touch up yung ito kasi yung everybody will continue to grow old. So whether we touch your eye or not, your grade will not remain the same from today to 10 years from now.
Okay.
Usually, if you're in your 30s, 25 and above, no? The change in grade is not a lot. Usually the change in grade is about 50 or 75 grade over 10 years or 15 years. So even if we LASIK you, your 500 grade before surgery is not gonna come back 500 grade. Maybe magka 50 grade ka or 75. Still clear enough. But if you really feel na, gusto kong sharper, as sharp as nung day one after my surgery, then your doctor, kami, we measure your corneal thickness if we can do more LASIK. So, pwedeng touch up or enhancement tawag namin doon. As long as it's safe because your cornea is still thick.
Okay. And
The
siguro
chance
related to
of a
that.
touch up, yeah, the chance of a touch up is about 2%. So, after
Okay.
all the patients, ginawa namin, 2%.
2% lang. Okay, and then Doc, kasi there's a question related to that, which is, ano ba yung activities or conditions that might cause my eye grade to come back after I do LASIK?
Siyempre, yung prolonged usage, no? Kung yung mata mo kaka-computer, kaka-gadget, kaka-game, talagang tataas pa ang grado mo. Kasi your eye is focusing more on near. So you induce a little bit of reading glasses mismo, no? Even if I've done LASIK and your grade is 0, pero kung for the next 10 years ay you're playing video game 12 hours a day, may babalik na grado. Hindi natin kayang pigilin yun eh. So, we just teach the patients every 3 hours, 2 to 3 hours of use, you have to rest.
Kailangan may pahinga pa rin.
Yung mata mo, oo, para hindi bumalik yung grado. And that usually works for most patients. Pero hindi ko pwedeng ipangako na, pag nilasik kita, 10 years from now, ganyan pa rin grade mo at ganyan pa rin vision mo. Hindi, kasi you grow old may wear and tear, parang kotse, may wear and tear.
Oo,
So
oo.
talagang hihina because of age.
At saka depende sa the care that you put into your
Pero hindi
vision.
na babalik yung 800, 500 grade. Hindi na babalik yun. Permanent din yung reduction. Pero hindi permanently, you will not change with your age.
Okay. And then Doc, here, there's one question here na, is there a ceiling eye grade to be a LASIK candidate? I have 600 right eye and 425 left eye, both with 200 astigmatism.
Kasi the screening will tell us, no? Kasi the screening will measure your corneal thickness, your eyeball. So, the first step is, like you, 600. You're in between the LASIK and the ICL eh. Diba?
That's right.
Pupunta ka dito, tetestingin ka namin, and then sabihin ko sa'yo, in the end kasi you will go home and you think about it and you decide. My job is to test you and tell you the options of what is safe to proceed and what is not.
Okay.
So, tapos, isipin mo. Then choose.
Okay. And then, Doc, here's another question naman from Isabel Loyola. Is LASIK also good for people with superior oblique myoclonus?
Yung mga merong muscle deviation problems, usually we don't want to touch that because it can worsen with time. So, again, part of the screening is to weed out all the abnormalities in your eye. If kasi we do your LASIK and your superior oblique problem gets worse, superior oblique is a muscle of the eye. Magdodoble yung vision, nagdodoble yung vision nila eh. So, we want the LASIK to be blamed for that. Well, the LASIK will not worsen that, but your condition can worsen. So, ingat lang.
Okay. And then here, Doc, this is another question. And I think interesting kasi from Des Estrella, I'm 56 years old, qualified pa sa LASIK is the first question. Nearsighted siya, 250, both eyes with astigmatism. After LASIK, magre-reading glasses pa ba? So, Doc, doon parang alanganin yung age niya at 56. Eh, di ba usually yung 60 mo,
So,
and towards cataract.
50 plus years old and may grade siya and may astigmatism, first we test, may cataract ka na ba o wala? So kung wala ka pang cataract, then we think of laser surgery. So for a patient between 40 to 60, there are two options. Option 1, is we do dioptics LASIK, make the far vision perfect for both of your eyes, and then you just wear reading glasses. Kasi 56 ka na eh, so kailangan mo reading glasses. Pero yung mga pasyente, mahilig mag-golf, mahilig mag-drive, yan ang gusto nila kasi malinaw yung golf. Ngayon, may mga patient naman na, ano pa yung ibang option? So, we can do supracore LASIK in one eye for reading and Xioptics LASIK for the other eye so that may far vision and may reading vision. Para bihira ka na magsalamin. Bihira, hindi no eyeglasses, bihira. Kasi pag sobrang liit, syempre mahirap. O pag sobrang layo. But most of the time, maybe 85 to 90% of the time, you won't wear glasses. So, there's an option for that, for the 40 to 60-year-old. Pero again, the screening will tell me kung pwede.
Okay. And then, ito Doc, again, it's a lot of people kasi some of the questions here tell me na meron talagang specifics about their vision that they do need to consult about. For example, si Beck Marilla, I've been using progressive lens and have astigmatism. Can all problems be cured by LASIK?
Yung nga, kung qualified ka for supracore, kung naka-progressive ka, then maybe a supracore LASIK will help you. Pero may measurements kasi yan eh. Susukatin pa namin. And then we will test you, we will simulate you. And then, ikaw ang magde-decide. Pero, kung okay ka simulation at pasado ka, pwede na, again, bihira ka mag-reading glasses. So, makakatulong yun.
Okay. And then Doc, how about kasi for those patients that do need who opt to do the ICLs? Ano yung advantage of that?
The ICL kasi means that we do not laser your cornea. So the main advantage of ICL is your eyeball is completely intact and natural. Wala tayong binawas. Pinatong ko lang yung ICL sa loob ng mata. The first advantage, no cut and no removal of tissue. Original eye. The second advantage of ICL, as I told you, it's the clearest and sharpest vision of all the options. So, ICL gives better vision than LASIK. Parang contact lens and glasses. So, for those of you who wear contact lenses during the day and glasses during the night, you know what we're talking about. Now, when you're with contact lens, it's clearer than ICL is clearer than glasses. So, ICL, top of the line. So, the top of the line treatment now is ICL. No? So, yun ang main advantages niya.
And then, Doc, kasi when people hear na implantable contact lenses, iisipin nila, para ba yung regular contact lenses that I have to maintain it? Kailangan bang may drops din ako nilalagay dyan? Kailangan ba siyang pinapalitan?
No, itong ICL kasi is we order this lens from a company in the US and they manufacture a customized lens for each of your eye. Then they send it to the Philippines. The material of the lens is the secret of the company because their material is stronger than the normal contact lenses. It does not become dirty, and it does not react when it's left inside the eye. Meaning, hindi masisira yung lens sa loob ng mata, and hindi masisira yung mata mo pag may lens sa loob ng mata mo. So,
hindi siya i-reject ng mata. Walang ganon.
Reject. Hindi mo kailangan linisin, walang maintenance. Iwan na sa loob ng mata for the next 20 to 30 years. That's why many people like it. No? Kasi maintenance free, parang LASIK maintenance free eh. No? Mas malinaw lang and nilagay ko na yung contact lens sa loob ng mata. So, pag ginagawa ko itong ICL procedure, tulog yung patient. Sa amin, sa patient eye, we put suero, you're asleep. 10 minutes per eye, the procedure is done.
Mabilis lang talaga to.
Basic, gising, pero 10 minutes per eye. PRK, gising, 8 minutes per eye. So, most of the time you're done in half an hour for both eyes. It's just
Okay.
that what is bagay to you, yun ang kailangan malaman.
And then, Doc, you mentioned kasi that for some people, syempre, when they get LASIK done, yung distance vision nila is quite clear during the day. For some people, they do say things like, kapag sa gabi, kapag nag-drive ako sa gabi, parang may glare ng konti or it's less
Right.
clear. Is that similar to if I do ICL?
So, when you touch the eye of anybody, whether LASIK, PRK, ICL, cataract surgery, anything na ginalaw namin yung mata, one of the consequences or side effects is glare. Ang glare means parang yung ilaw may rays of light, glare, or may halo effect, yung ilaw tapos may ring around. No? So usually, yun ang side effect of changing the optics of the eye. Now, most of the time, in 6 months, this shrinks, no? The glare and halo shrinks. So pag 6 months na, 8 months na, 1 year na, maliit na lang yan. Pero sa simula, medyo obvious. So pag
Yes.
nagmamaneho sa gabi lang to sa daytime bihira to. Sa gabi, kaya pag nagmamaneho sa gabi, mapapansin niyo yung glare and halo. Now,
Mm-mm.
in terms of what causes more or less, the ICL causes the least glare and halos,
Okay.
followed by LASIK. No? So, mas maraming glare and halos ang LASIK at PRK, lalo na kung mataas yung grade. So,
Mm,
mas mataas yung grade, mas maraming glare and halo pag ni-LASIK o PRK. Pag 100, 200 lang grade, maybe maliit lang yung glare and halos. Pero pag
oo.
500, 600, 800, mas may glare and halos. And may isa pa, yung contrast vision sa gabi. Ibig sabihin ng contrast is, pag nakatingin ka sa white background, tapos may gray line, mas
Mm-mm.
hirap i-distinguish kaysa black yung line. So yung sharpness ng contrast ng colors and black over white, mas affected ng high-grade LASIK o PRK.
Okay, okay.
ICL, hindi affected ang contrast. That's why mas malinaw ang ICL, lalo na sa gabi. So that's
Okay.
another advantage. Although it doesn't mean na LASIK is not clear at night, it's also clear at night. Pero may decrease in contrast more. So,
Oo.
ina-explain din namin sa patient. Pero millions of people have had LASIK and nobody says they cannot drive at night. No? Bihirang-bihira yung mag-complain. Pero, syempre, pag naka-ICL ka, parang, oh my God, ang linaw-linaw. Ganun, no?
Oo. Oo. So it's really just a difference. And it's parang wini-weigh mo kung ano yung options mo talaga and what is
Yes,
important
yes,
to you.
correct.
And then, Doc, let's say a patient has undergone the screening, they've decided to do the surgery. Ano ba yung do's and don'ts nila after the procedure that they really have to keep in mind?
So, whether LASIK, ICL, sinurgery namin yung mata mo. So, I don't want to trivialize it na, simple lang LASIK, hindi pwede. Kasi, importante sa atin, yung safety nga of the procedure. So, the most important is huwag kang magka-infection. So, during surgery, rarely does anything go wrong. No? Bihirang-bihira yung magka-problem during surgery. Pero after surgery, uuwi ka na. So yung operating room namin malinis. Actually, antigen test ka namin on the day of surgery dito. So hindi ka
Yes.
makakapasok sa operating room namin, hindi ka namin siguradong virus-free. Kasi syempre takot din kami ipasok mo yung virus sa amin. So may antigen test ka. Pero yung pag-uwi mo, syempre sa bahay, may tubig, madumi, mahangin, so mag-ingat. So, we will give you goggles and we will give you contact lens, antibiotic and steroid drops. So, meron
Okay.
kang drops at meron kang goggles. Pero, ayaw kong may pumasok na tubig sa mata, especially for the first week. So, we cannot guarantee the cleanliness of the water in the sink, no? So, do not wash or rub your eye for a week. Usually, I tell the patients, mineral water, tapos tissue, tapos punas-punas lang, ganyan. So, no wetting or rubbing for at least a week. No sports, no exercise, and no eyeliner or eye makeup for 2 weeks. And then no swimming for a month. Yun yung most common precaution na sinasabi ko. Kasi ingat lang, kasi if you're careful, we all will enjoy the results of your surgery.
Mm-mm. And then, Doc, syempre, after you get surgery done, you have to come in for follow-up. So why is it so important for them to do the
Yeah,
checkup the
they
day
kasi,
after?
yeah, follow-up is, my normal schedule is 1 day after, then 1 week after, then 1 month after, then 3 months, 6 months, then once a year. So, long-term follow-up lahat ng patient ko. Some of my patients, I've been seeing them for 18 years, 16 years, no? Hindi, usually for the first 5 years, we want to see you once a year. Then after 5 years, syempre, darating na sila every 3 years, 4 years, gano'n talaga, no? Pero, you will grow old. So we want to see how you're doing as you age. So may check-ups to make sure you're okay.
Okay. And then, Doc, you already mentioned that it's one of our requirements before you undergo any surgery is that kailangan mo magpa-antigen test. Kasi dahil panahon pa rin ng pandemic, kailangan lang tayo makasigurado. So how are we ensuring yung safety of undergoing a LASIK or any other vision correction surgery now that there's COVID-19?
So if you come here to Asian Eye, you'll notice that first, we've drastically made changes to how we do things. So first, if you don't have an appointment, the building will not let you in. That's the first thing, no? Tapos, when we set your appointment, our customer service people will actually interview you for symptoms and all that para safe.
Mm-mm.
When you come, I'm sure you notice that we're wearing these PPEs, iba na yung damit namin, no? Dati
Oo.
mask na lang kami. So ngayon, nakabihis na kami, nakabalot kami, may gloves, double mask, and everything. So we protect us and we protect you by making sure na may barriers in the clinic. Tapos, syempre, may alcohol precautions. Tapos, on the day of surgery nga, we limit you to one companion and then may antigen test. Kami rin nag-test kami regularly, so pati kayo, test namin. So, maingat tayo dapat lahat, but now we've gone back to our usual clinic schedule. We just cut down on the number of patients para hindi crowded masyado yung clinic. So, appointment setting is important, no? Kasi we stagger you during the day. Tsaka hindi naman everyday nasa clinic ako eh. So, clinic ko Monday, Thursday, Saturday. So, we see patients. And then my surgery schedule is Tuesday, Friday. So, nakaset lahat para maingat.
Okay. And then, Doc, syempre, when it comes to doing the surgery inside the laser room already, meron sila yung sinasabi na yung laminar airflow system as well as yung HEPA filter. So, what do those do and how do they make it safer for patients?
Kasi yung hindi kami nasa mall, no? So the first thing you will know is our main hospital. We have an operating room complex here, the 10th floor of this building, is operating rooms and laser rooms. So that was designed so that the air circulates in a way na may exhaust, no? So yung laminar airflow has filters na filter yung bacteria and virus. So pag nakita mo yung ceiling namin, doon dadaan, ganito kakapal yung foam ng HEPA filter eh. So dadaan yan yung air, papasok, no? So actually, nung ginawa itong Asian Eye, pinattern yung airflow like a semiconductor. Gumagawa yung mga semiconductors na bawal yung vapor, bawal yung bacteria,
Particles,
bawal
ganyan.
yung particles, and may temperature and humidity setting. So, ginaya yung operating room namin to those specifications. Kaya, nakita mo yung picture sa laser, nakita mo yung ceiling, may parang mesh doon kasi doon dumadaan yung hangin. Tapos sa ilalim may exhaust. So, protected kami. So, umaandar yung air, hindi siya stagnant the whole day.
Okay. And then, Doc, I think one of the other questions, I think one person in our chat has also asked, is there a chance to not really have 20/20 vision after LASIK or even after touch-up procedure? And ano ba yung pwedeng gawin, or are there any options available if that happens?
Yes. So, we have to be realistic here. Even I tell patients na I cannot promise perfect vision to everybody. So, our statistics show that we achieved 20/20 in about 95% of patients in LASIK. and PRK. In ICL, that's about 98%. So there's a 2 to 5% chance that you're not 20/20.
Mhm.
So, bakit ganon? Number one, pwede kasing nagpa-fluctuate yung grade mo. Number two is, the laser, when it fires on your eye, biology pa rin yan, may healing, no? So, pag may sugat, may healing. So, yung healing pattern ng each person can be a little different. Kaya, kahit na when I do your LASIK, I do the same for everybody else. So, if I've done 20,000 LASIK, I did it the same way. Pero hindi lahat ng tao heals the same way and reacts the same way. Kasi medicine nga is a little bit of may variability. So, pag hindi ka nag-2020, usually malapit ka sa 2020. Hindi ka malayo sa 2020, malapit.
Oo, oo.
Pero
Hindi
pwede
lang
kasi sa
siya
TikTok, ito
oo.
malinaw. Ito parang hindi masyadong malinaw ah. O,
Oo.
yan. Diba? So, inaantay namin ang 3 months. Then, if kayang i-touch up, whether LASIK or PRK, we will do a touch up.
Mm, mm.
2% chance of a touch up.
Okay.
ICL, if hindi ka masaya, and grade ang issue, minsan, pwede tayong humingi ng kapalit na lens, hingi tayo sa may manufacturer and papalitan. Although bihira akong gawin yan kasi pag nasa loob na yung lens, ayaw ko nang galawin yung lens.
Oo, oo. Nandun na siya eh. Yes.
Mas maselan ako, I'm more careful with the ICL in terms of doing any touch-up procedure because that is inside the eye. When it's good enough, good enough. Pero realistically speaking, we cannot promise everybody perfect vision, but we try our best to give everybody happy vision. No, makikita
Okay.
mo how much you've improved. No?
Yes. So functional and something
Actually,
that you can enjoy.
alam mo na nag-improve eh. Di ba?
Mm,
Pero
mm.
ang hirap mangako talaga. Alam mo, I've tried. No? I've done so many. I've tried. No? Siyempre,
Ah,
hirap mangako eh. Parang ano yan eh. Like anything, no? Mahirap eh.
yes. And ito, Doc, I think that's related to this other question from Anna Ludwig. Is that, is there a warranty for these types of surgery? So let's say nagpagawa sila ng
So,
procedure.
yeah, sa LASIK and PRK, yung warranty means na we will touch you up for free, no? Usually, we know that the laser worked or not within the first 6 months.
Okay.
Pag 6 months na, then, if kailangan i-adjust, ina-adjust ko na yan. Walang bayad. Usually, just have to pay for the antigen test or something. Okay? Now, if 10 years na at nagbago, syempre tumanda ka na eh. Then you pay the facility fee. I don't charge. You don't have to pay me. You pay a part of the cost of the surgery, but not the full surgery. So,
Okay.
meron ganyan kaming service for patients. Lucky enough, is 2% or less of all the people I've done. No? So, hindi naman marami. Pero, hindi pwedeng hindi namin address kung hindi ka masaya eh. Di ba? Parang, oh, Doc, lumabo eh. Ganyan-ganyan eh. Di ba? So,
And then, Doc, ito, one question then from Ms. Elena Absolute is it possible that you'll have cataract after the LASIK operation? And how will this be corrected?
No, the cataract is not, there's never been reports that the laser caused the cataract. But aging causes a cataract. Steroid causes a cataract. And the most notorious culprit of cataract is diabetes. So, if you have cataract, then kailangan operahan yung cataract. Now, many patients have had LASIK before, no? 10 years ago, 20 years ago, nagpa-LASIK sila. Ngayon, 60 years old na sila, 65 na, and they have cataract. So we can do cataract surgery here, no? On patients who have had LASIK before, safely. The only thing different about cataract surgery in patients who have had LASIK is there is a mathematical formula to calculate the grade of the lens implant. So yung cataract, nilalagyan namin ng lens implant for you to see better. Now, your doctor has to know how to compute this mathematically so that tama yung gradong ilalagay sa mata mo. The surgery is the same. So, in Asian eye, we have conventional cataract surgery using blade. And we have laser cataract surgery here. So again, patient can choose blade cataract surgery, laser cataract surgery. Then we have to put an implant, whether blade or laser cataract surgery. Then calculate yung grado.
Oo.
So importante na marunong yung doctor mo. So kami sanay kasi we have many LASIK patients na tumanda na eh. So sanay kami mag-calculate for the patient.
Okay. And then Doc here, another question here is, kapag naka-IOL na, qualified pa ba magpa-LASIK?
Yes, so ganito. IOL means the intraocular lens implant put during cataract surgery.
Okay.
So, pag inoperahan ka na at nilagyan ka ng lens, sometimes kung hindi accurate yung pag-calculate ng grado ng doctor mo, may matitirang grado.
Yes, okay.
Di ba, parang the calculation of the grade of lens for cataract surgery, ang default kasi is palinawin yung malayo as much as possible. So as close to zero grade para malinaw yung malayo. Of course, there are lenses that can see far and near, no? Parang multifocal IOL yun. Pero again, the grade should be as close to zero as possible. For example, kasama ang palad after cataract surgery, may natira sa yung 150 grade. So kailangan mo magsalamin to see clearly the 150 grade. And then gusto mo malinaw yung malayo, alam mo, gusto mo mag-drive na walang glasses. Isi-screen ka namin. And kung pwedeng i-LASIK yun after cataract surgery. May mga nagawa na kami ganon. Pero dadaan ka sa same screening as somebody who's 25-year-old, no? Kasi isi-screen ko kung safe So we screen first before we do LASIK on you. But the answer is yes. Pwede kang i-LASIK after cataract surgery and may intraocular lens implant ka. Pwede yun.
Okay. And then, Doc, related to that also, if someone has had PRK or LASIK, and they eventually, the next couple of years, parang siguro yung sinabi niyo, Doc, habang tumanda, nagkaroon ng konting grado, pwede ba silang maging qualified to do ICL naman?
Yes. So, ganito. May mga tao na many years ago, 900 grade, 1,000 grade, nagpa-LASIK sila, nagpa-PRK sila. So, ang natirang grado, 50, masaya sila. Then over 8 years, 10 years, bumalik 200 grade o 300 grade. Tapos, pupunta kayo dito, we screened you. Pag screen namin, ay, manipis na yung cornea. Kasi 1,000 yung tinanggal pag binawasan mo yung cornea ng 1,000, siguro kalahati doon naubos na. So, hindi na pwedeng i-laser pa. Di ba? So, ICL ang nilalagay namin dyan. So, the answer is yes. Yung mga may grado pa after LASIK or PRK but cannot have more LASIK or more PRK, hindi pwede ng touch-up, ICL ang ginagawa namin dyan. Tama yun. Pwede yun.
Okay. And then here, Doc, sabi naman ni Dorothy, I'm qualified for PRK and has already done the screening sa clinic. Pero hindi pa daw siya ready to do the PRK procedure. Kapag pinag-screening niya yung sarili niya ulit, possible po ba na pwede na ako sa ICL?
Yes, we will check yung ICL kasi merong specific measurements yan kung kasya yung lens sa loob ng mata mo.
Okay.
We will see for that. And of course, you can have ICL. Para you'll have better vision than PRK. Di ba?
Mas maganda pa ngayon dahil you opted for ICL.
So, may mga patient na ayaw talaga nila ng pain. Yung PRK, walang choice. There will be 3 days of pain because of the way the procedure is done. It's not so bad, but some people don't like any pain. So, ICL talaga pinipili nila.
Okay.
We will do measurements for her.
All right. So ganun, that's a good tip for the person nga. Yun. You find out na pwede ka mag-PRK, but now that you've heard about ICL, it sounds like a good option for you down the line when you're ready to have a procedure done. So yun, Doc, I think those are the bulk of the questions. And a lot of the other questions naman you answered during the course of our discussion. So siguro, Doc, for those who want to undergo LASIK screening or get checked with you, where can they find you?
I think let's either through our Facebook or you need to make an appointment to have screening, no? So, you need to get in touch with us, either phone, cell phone,
Mm-mm.
online, no? So,
Oo.
uh, then, pa-appointment kayo for screening. Tandaan nyo, if you're a contact lens wearer, soft contact lens, 5 days before you stop wearing contact lens, before you come see us for screening. So, tatawag kayo, sabihin nyo, gusto ko ng Lasik screening, or gusto ko ng ICL screening, or gusto ko lahat screening. Pwede yun. And then, hard contact lens, 3 weeks before, just wear glasses. And then, I see you, andito ako to explain the procedure. No? So, some of the patients, when they come, they already have a list of questions in their cell phone.
That's right.
Tanungin
Oo.
nyo ako, walang problema yon.
And that's a good idea kasi minsan, Dok, kapag nagpapakonsult sa inyo, over the course na nagpa-screening siya, nakakalimutan niya yung meant niya itanong. So you might as well write it down, you might as well type it into your phone, and then you're ready when the doctor asks you if you have questions. So, Doc, for those that want to visit you, you're in Rockwell on Mondays, Thursdays, and Saturdays, and then you're in Trinoma on Wednesdays.
Yes.
Mm-mm. And then, one thing that, Doc, you were talking about and you were emphasizing is that, syempre, ang kailangan niya magawa is Lasik screening. That is the best way to find out kung qualified ka for Lasik or any of the other vision correction procedures. And it's a good time to actually get the screening done kasi we do have an e-gift certificate that where you can avail of our Lasik GC, so that one certificate gives you 2 Lasik screenings for only 3,150. So you go onto our website, www.asianeyeshop.com, and then doon, if you and a friend, you and a sibling, you and even your parent, you're thinking about getting Lasik done, well, you might as well take advantage of this offer para at least may kasama ka habang you undergo the screening. One thing kasi that people do talk about is medyo matagal yung procedure because we are so thorough about it. We do care kasi about how safe it will be for you to undergo any procedure. It helps to actually be there with someone else so that you can discuss some of your concerns or maybe some of your goals when it comes to correcting your vision. And then, of course, again, doctor said, by appointment only muna tayo. So if you wanna come, please don't just do a walk-in. Please schedule the appointment. And remember, we're gonna do a slew of tests. Medyo maraming tests. So medyo after that, pagod ka, and na-dilate yung mata mo, so medyo blurry ang vision. Have someone help you get home. Don't drive yourself home if you can help it. Take a Grab if you want, or have someone bring you home. And then, of course, for patients with eye concerns, you can call Asian Eye hotlines. Kasi aside from Lasik, Doc, syempre, you also take teleconsultation consultations, right, Doc?
Yes, we do. Yung teleconsultation lang, mahirap kung LASIK, no? Kasi we need to test you eh. So, yung mga teleconsult, yung mapula lang mata mo, mga ganyan. Pero usually, if you really want a thorough check, you might as well come here, no? Para isahan na lang, no?
So,
Wala kayong pasok ngayon, so come on over.
Yes, that's right. Lalo na long weekend pa lang, Doc, diba? Nag-Chinese New Year, and then we had the weekend. So I'm sure Dr. Ang has been quite busy seeing a lot of the patients who took advantage of the holiday. So you can, in fact, use our teleconsultation hotlines, and then you can also opt to go to the Rockwell Clinic kasi we're open from Mondays to Saturdays from 8 a.m. to 4 p.m. And if you want to do a teleconsultation, you're not confident na yung eye concern mo is something that requires a full checkup, then call us up. Call us up, we'll guide you through the process. Kapag yung kausap niyo nararamdaman niya na ang kailangan mo is a full checkup, then they do in fact set you an appointment to visit the clinic. And then we're just flashing the numbers on the screen. So take your phone out, take the photo, send us a message on Facebook. We're quite responsive. And for those that have some additional questions, you can continue to send us a message through our Instagram, our Facebook, or our Twitter, and we'll get to them as soon as we can. And Doc, I know you're quite busy today. Today was a surgery day for you, no? Thank you for spending the afternoon with us. And of course, thank you to the viewers of our Facebook Live session. Is there something, you have additional tips, Doc, for people who are watching?
No, I hope that we were able to answer most of the questions online, and we are here to help, no? So Asian Eye is here for you to provide the highest quality of eye care to everybody. So please come and see us anytime, no? Get in touch with us. We hope to see you. Thank
All
you.
right. Thank you. Thank you, everyone, for watching. And please continue to stay safe.